If you take metformin and you're scheduled for surgery, your doctor will likely tell you to pause it temporarily. Let's talk about why that happens and what you need to know. Metformin is the most commonly prescribed medication for type 2 diabetes. It works by reducing how much glucose your liver produces and helping your body use insulin more effectively. Under normal circumstances, it's very safe, and your kidneys eliminate it from your body unchanged. But surgery creates some unique challenges. When you're having a procedure, several things can temporarily affect how well your kidneys work. You're fasting beforehand, which can lead to dehydration. Anesthesia can affect blood flow to your organs. Some surgeries involve blood loss, and if you need imaging with contrast dye, that can also stress your kidneys. Here's the concern. Metformin leaves your body through your kidneys. If your kidney function drops even temporarily, metformin can start to build up in your bloodstream. When that happens, it can interfere with how your cells produce energy, particularly in your liver and muscles. This can lead to a rare but serious condition called lactic acidosis, where lactate builds up in your blood faster than your body can clear it. Now, the absolute risk of this happening is low, especially if your kidneys are working normally going into surgery. But because lactic acidosis is potentially serious, most healthcare teams take a cautious approach and pause metformin around the time of your procedure. So when exactly should you stop? This is where it's really important to follow your specific care team's instructions. For many elective surgeries, if your kidney function is normal, the typical protocol is to hold metformin on the morning of your procedure. Your surgical and anesthesia teams will tell you exactly what to do, including whether you should take a dose the night before. The timing might be different if you're having a procedure that involves contrast dye. The FDA recommends stopping metformin before contrast procedures if you have moderately reduced kidney function, liver problems, heart failure, or if you're receiving contrast through an artery rather than a vein. For minor procedures under local anesthesia without contrast, the plan may vary. Your healthcare team will give you specific instructions based on your individual situation. It's crucial to follow your doctor's instructions exactly. Don't stop metformin on your own without talking to your surgical team, and don't continue taking it if they've told you to stop. Do not start, stop, or change any medication without guidance from your clinicians. What about your blood sugar while you're off metformin? This is something to discuss with your healthcare provider before surgery. Depending on how long you'll be off the medication and how well controlled your diabetes is, they might adjust your other medications or have a plan to monitor your blood sugar more closely. Some people might need temporary insulin coverage during this period. Your diabetes care team and surgical team should coordinate on this. After your surgery, when can you restart metformin? For most uncomplicated surgeries, many teams restart metformin within 1 to 2 days after the procedure, but only after your care team confirms it's safe. There are some conditions that need to be met first. You need to be eating and drinking normally again. Your blood pressure and overall condition need to be stable, and your kidney function needs to be adequate. Your healthcare team will assess these factors before giving you the green light to restart. If you had any complications during surgery or if you needed contrast dye, they might want to check your kidney function with a blood test before you resume metformin. There are some situations where extra caution is needed. If you already have reduced kidney function going into surgery, your doctor will take that into account when planning your care. If you have other conditions like liver disease or heart failure, your healthcare team will factor those into their recommendations as well. This is why coordination between your surgical team and your diabetes care team is so important. When should you reach out to your doctor? Contact your healthcare provider if you develop any concerning symptoms after surgery, especially if you've restarted metformin. Symptoms like unusual muscle pain, extreme fatigue, difficulty breathing, unusual sleepiness, stomach discomfort, dizziness, or feeling very cold could potentially indicate a problem and warrant medical attention. Also, reach out if you're unsure about when to restart your metformin or if your blood sugar is running higher than usual while you're off the medication. So here are the key takeaways. Metformin is typically paused around surgery to prevent a rare but serious complication related to temporary changes in kidney function. Your healthcare team will give you specific instructions about when to stop and when to restart based on your individual situation and the type of procedure you're having. Coordination between your surgical and diabetes care teams ensures you stay safe while maintaining good blood sugar control. Always consult with your healthcare professional for personalized medical advice about managing your medications around surgery. Follow the specific instructions from your surgical, anesthesia, and diabetes care teams. Have you had surgery while taking metformin? Share your experience in the comments. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.